Balversa tablets is used to treat bladder cancer. Active ingredient Erdafitinib. Erdafitinib belongs to a class of drugs known as kinase inhibitors. It works by slowing or stopping the growth of cancer cells that have a certain type of abnormal gene. Indications. Balversa is used in adults to treat bladder cancer that has spread to other parts of the body, metastatic or cannot be removed with surgery. Balversa is used only if your cancer has a specific genetic marker, an abnormal FGFR gene, and if you were treated with at least one other platinum cancer medicine that didn't work or has stopped working. Your doctor will test you for this gene. Balversa is usually given after other treatments have failed. Balversa is approved by the US Food and Drug Administration on an accelerated basis. In clinical studies, some people responded to this medicine, but future studies are needed. How to use. Take Balversa exactly as prescribed by a doctor. Follow directions on a prescription label and all medication guides or instruction sheets. Your doctor may occasionally change your dose. Swallow the Balversa tablets whole once daily with or without food. The recommended initial dosage is 8 mg once daily, with a dose increase to 9 mg daily if certain criteria are met. If you vomit shortly after taking Balversa, do not take another dose. Wait until next scheduled dose time to take the medicine again. Your doctor may want you to use artificial tears or other lubricating medication every 2 hours while you are awake. Keep using this medicine for as long as your doctor has prescribed. Usual adult dose for urothelial carcinoma 8 mg orally once daily. Increase to 9 mg orally once daily based on serum phosphate levels and tolerability at 40 to 21 days until this is progression or unacceptable toxicity. Contraindications. It may be harder for you to get pregnant while you are using Balversa. You should still use birth control to prevent pregnancy because the medicine can harm an unborn baby. You may need to have a negative pregnancy test before starting Balversa. Tell a doctor if you have ever had problems with your eyes or vision. Both men and women using this medicine should use effective birth control to prevent pregnancy. Erdafitinib can harm an unborn baby or cause birth defects if mother or father is using this medicine. Keep using birth control for at least 1 month after your last dose. Tell a doctor right away if a pregnancy occurs while either the mother or the father is using Balversa. Do not breastfeed while using this medicine and for at least 1 month after your last dose. Warnings. Before taking Erdafitinib, tell doctor pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor pharmacist your medical history, especially of eye or vision problems, kidney disease or liver disease. Before having surgery, tell doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Balversa side effects. Get emergency medical help if you have signs of an allergic reaction to Balversa, hives, difficult breathing, swelling of your face, lips, tongue, or throat. You may have high phosphate levels and your blood will need to be tested often. Tell a doctor if you have symptoms such as numbness or tingling around your mouth, muscle stiffness, body aches, itching or rash, tiredness, trouble sleeping, nausea, vomiting, loss of appetite, or feeling short of breath. Call a doctor at once if you have vision problems, vision loss, eye pain or redness, or problems with your fingernails or toenails, pain, bleeding, separation of the nails from the skin, nail bed, unusual breakage, changes in nail color or texture, cracks or infection in your cuticles. Your cancer treatments may be delayed or permanently discontinued if you have certain side effects. Common Balversa side effects may include dry eyes, dry mouth, mouth sores, hair loss, dry skin, problems with your fingernails or toenails, redness, swelling, pain or blisters of the palms of your hands or the soles of your feet, muscle pain, feeling tight, abnormal liver or kidney function tests, low sodium levels, low red blood cell counts, nausea, stomach pain, loss of appetite, diarrhea, constipation or changes in your sense of taste.